Hello, Errol Forde, and this is in continuation, part two of living in the dementia world. And the last time we were looking at what happens to your loved one when they are firstly brought into the nursing facility, or in other words, the skilled nursing facility, those who suffer from dementia. Normally, it's a care plan team that is established to comprehensively take a look at your medical records, your loved one medical records, which give them the kind of knowledge that they would need to establish the right kind of therapeutics for your loved one and care. The care plan team is made up of the director of nursing, a social worker, executive director, activities director, maybe a nurse, all depend upon the facility and who they have to make up that care plan team with that is rightfully in position to do so. Then after the care plan team is established and would have invited a comprehensive review of your loved one medical records, then an action plan is put into place where out of that comes a comprehensive analysis, which is formulated in its first initial assessment. So it is a comprehensive assessment of your loved one as they enters the nursing facility. This is also followed up by something called the BIMS. The BIMS really stands for a brief interview of mental status. And what that really is taking a judgment from a scale of 0 to 5, where you have a person who may just pass 0 to 1 or not pass at all, someone fall in between that point. And in layman terms, if the person reach a score of 5, their cognitive ability is pretty good, and often that goes a long way in building a care plan for your loved one. Now, I often say it's vitally important that even though a person cognitive ability may still be good, it is vitally important that you also interview the next of kin. And the reason why is that even though the person is cognitive, always remember that they are in a nursing home for a lot of reasons. And that's because their memory somewhat is not serving them well. And you want to get as much adequate information as possible that you can come up with almost a perfect care plan for your loved one. When all this is taken into consideration, the care plan basically is formulated off of a focus, a goal, and an intervention. Those three criteria are a part of the care plan, which assists the workers of CNAs and activities and who work in the activities department to make rational decisions and give the right kind of treatment to your person in terms of exercises or therapeutics or whatever the case may be. It assists the CNAs in how to go about working with you throughout your ADLs, which is your active daily living, that you would be, your loved one will have to be dealt with on a daily basis. So the care plan plays an essential role in your loved one's life while they are in a nursing home. And that is something you should be proud of because it's there to ensure and make sure that your loved one are well taken care of. So it's not really a situation where you have to got these stressful thoughts of what's going on to your loved one. And obviously in the first 48 hours, your loved one is monitored that there are no elopements. Often when new people come into at the point of intake, the place is strange. It don't look like what they normally used to live in. Chances are they get a little bit disoriented and want to leave and look for escape route to get away from being at that place. They want to go home. Often you hear residents say they want to go home. And that's because home would have somewhat resonate in their long-term memories, because that's how dementia is. Your long-term memories is the last to really go, but it's the erasement of your short-term memories that often disappear. And in others, it goes at different rates based on the person situation. So now you have an idea of what the care plan is all about at the point of intake. We want to look at some different types of dementia, because this is very essential. And then we will look at the approaches at the end of this program. So the first and the most common type of dementia is Alzheimer's. This categorized by memory loss, cognitive decline, and changes in behavior. And 60 to 80% of people who actually dies from dementia really dies from Alzheimer's. And we have another form of Alzheimer's. It's called vascular dementia. And many people know about this simply because this form of dementia comes through the blood vessels damage in the brain, and it leads to cognitive problems. And often, sometimes you can see these people turn at a point where they may have a stroke. So that's a common form also of dementia. It can also cause dysplasia in the face, where the face is twisted and that kind of stuff. So that's another form of vascular dementia. And as I said, it's caused by the eruption of blood vessels in the brain, leading to cognitive problems. Then we have dementia with Lewy bodies. And this involves abnormal deposits in the brain, affecting memory, movement, and sleep. So this is a form of dementia that you have to look out for too, because you may have a loved one at home and you recognize they are sleepless, they're not getting much sleep, the body movements is not really looking right, they may be stumbling from time to time, and the presence of memory loss are there. You can see it for yourself. There's no trying to figure that one out, because things that would normally be normal to your loved one is no longer with you, and they're losing their memory day by day. At that point, you really need to get some form of medical assistance. You need to start thinking about getting them in the right facilities that they can be treated. And fourth, we have the frontotemporal dementia. And what that is, that's the biggest part of the brain, and affecting the frontal lobe and temporal lobe of the brain, causing changes in personality, behavior, and language. So when your frontal lobe is starting to deteriorate, a lot of signs happen with it. You get personality, behavior, language may start to slur your language a little bit, and personality may seem to have different personalities, behavioral personalities, and this is normal. When this happens again, you need to have psychological evaluation done. You need to see a doctor and get wisdom and understanding as where to go from there. That takes you a long way in looking out for your loved one. And that's common disease, and we don't hear about it that often, but it is Huntington's disease, an inherited condition that causes progressive cognitive decline, movement disorders, and psychiatric problems. So when you hear about inherited, it's something that can be transcending from one generation to the next, from one family to another. As the generation lineage goes on from one to the next, you may find that your loved ones carrying on something that your grandfather probably had or your father have. Now your son is having it, and this is when it's hereditary, and that's the Huntington's disease is a hereditary condition that causes progressive cognitive decline, movement disorders, and psychiatric problems. Now this one here is even a little bit more dangerous. It's not talk about that much because you don't hear about it that much, but it's called the Creutzfeldt or Jacob disease, a rare rapidly progressing form of dementia caused by a prion protein. So this is a protein that the brain produces. Is toxic. It's full of toxins, and it really destroys the brain quickly, and the person lifespan is not that long. That is something hard for family members to deal with. The best thing you can do is just see a doctor and let the doctor do his best to preserve life as long as they possibly can. But that's the Creutzfeldt or Jacob disease. And then there's a normal pressure. Hydrocephalus, a condition where excess cerebral spinal fluid builds up in the brain, causing cognitive decline. And so you can have spinal fluid building up in your brain and causing cognitive declines. And that is another form of dementia that can really destroy your loved ones also. For all these forms of dementia, you definitely need medical intervention to see what's best to deal with. And on the list, we have Parkinson's. Everyone basically knows about Parkinson's form of dementia. This is really terrible. It's somewhat neurological to some degree. Parkinson's disease, dementia, a complication of Parkinson's disease that affects memory, thinking, and behavior. So you can have, under the Parkinson's disease, you can have a lot of issues there that it really messes with your mind. It destroys your memory, your behavior patterns are completely altered, and this can make life miserable for your loved one, your family members, everyone. They need critical and special attention. You need to seek a doctor and have them look at as soon as possible when that Parkinson start with you, or any form of the development of Parkinson's disease. We have this mixed dementia, which is when two or more type of dementia occur simultaneously. And a person got multiple forms of dementia while suffering from dementia, and that person is hard to really keep comfortable or make happy. There's a battle in their life. It's a real crucial battle in their life. And sympathy and love and best treatment possible can give is all you can do to really assist that person. Then we have the posterior cortical atrophy, a rare type, again, that affects the back of the brain, causing memory loss, visual problems, and difficult with attention. So this is somewhat slightly looking like autism, but it's not autism. It's a form of dementia. Your attention span is short-lived, and it's hard to keep that person within a form of control or anything like that, but they need to be monitored and well looked after, because they can easily drift and do things that they shouldn't and hurt themselves and cause harm to themselves. And then we have the corpuscle degeneration, a rare condition that affects movement, memory, and language. And we have to look at that because anytime your movement is interrupted, you're liable to suffer bodily harm by off-balancing when you fall and hit your head or break an arm or break a leg. These things can easily happen. And with that form, also, there's a language barrier. To some degree, their language are not as normal as it used to be. The person may be mumbling words or trying to speak something, but they understand to some degree what they're speaking, but to you and I, it doesn't make sense because it sounds like gibberish. But with that, that kind of person needs to be monitored. Often a one-on-one monitoring is good for that person while in a nursing home. And if it's in your home, at home, someone definitely have to be there with that person, or else the possibility of bodily injuries is susceptible for that person to fall into. Another form of dementia is alcohol-related dementia. And I think for this one, basically, you may have some form of treating this. And if a person can abstain and control their alcoholic behavioral patterns, and it's a good chance that you can get over this form of dementia. It is usually caused by over excess alcohol consumption. Everything should be used in moderation. But if you find that your loved one is drinking themselves to death and they're suffering dementia because of excessive drinking, they need to be either placed in a nursing home free from the bottle, where they no longer have access to drinking alcohol beverages, that is. They need to be in a place where they can secure themselves. And the only way they can do that is if you, the family member or next of kin, decide to have them placed there. With all of this come a lot of responsibility. The responsibility that these things can pop up over a period of time before you even noticing what's going on, and by the time you catch it, it's a little bit too late, and then automatically you have to look to get them in a nursing home, and then there's a lot of financial responsibilities that falls on you. The possibility of giving it your work to look after the person, there's a good likelihood you just can't do that because you have your mortgage to pay, you have your bills to pay, you have your kids to send to school. There's so much you have to do. And normally this happens to the grandparents in the house because most dementia patients over the age of 50, 60% and up of dementia patients are over the age of 50, even though it could be at any age, right? So it is quite essential that you have to look at the best way possible to have your loved ones treated. You can't keep them at home. You may not very well be qualified to take care of them based on the stage they are at. You may have to get some either professional person come in and give them the attention they request, or good likely to have them into the nursing home. Most of the times, Medicare subsidize nursing homes for some of these people, but like the reality, you still have to meet some requirements in order to get Medicaid and Medicare and so forth. This can cause a financial burden on families. This can cause families to try to restructure their financial lives to make things happen. And there are times where you just can't do nothing. Your hands are full, especially in harsh economic times like these. You can't do anything. So the best diversion, the best route to take, I say, is to try to get some assistance from Medicare or Medicaid to assist your loved ones with. With that said, I want to just take a look now at the approach. And this approach of dementia people works for the nursing home as well as it will for those who are at home. If you're in a position to take care of a dementia person at home, there are things you must understand. Your normal approach, which may very well be hard because you are accustomed doing things with your loved one way all the time. But here's a moment where you have to totally restructure the way how you approach that person. You can't just creep upon them like that or do anything like that. But the first part of approaching anyone with dementia, be it in your home or in a nursing facility, is always approach them slowly from the front. Slowly. Make sure you have a pleasant demeanor, a smile on your face. Place your hands on their hands. Slowly speak to them. Wait. Give them time to respond. Get their attention. Remember, their minds are no longer working like yours. Their brains are out of order. They can't function like you. Their response to stimulus can't be like yours or any verbal communication. They need time. You have to take time out with these people. Approaching them from the back is definitely wrong. You can startle them, and a good likelihood they will punch back or push you off or even punch you in the eye or do something. And even when you approach them from front, keep your arms distant, keep your arm length, keep your distance. You don't want the person to reach forward because, here again, they can smile with you in 1 minute and in the other they can change. The brain just doesn't function right. It doesn't spark correctly. So therefore, their personality changes can be altered in seconds. And a nice smiling person you're talking with can just turn in a monstrous way in another second, punch you in the eyes, or cuff you in the face, or even beat you up. In some cases, they do. We have to let prudency and wisdom be the principal thing when we are working with dementia patients. It is essential that we do this because they want to be loved. And since they're not home with what little cognitive ability they have, they want to feel appreciated, welcome, and loved, especially if they never used to have it before. This is the moment in time that you have to express love and concern. You've got to give them your undivided attention at all times. It's not a job for everyone. It's not taking care of dementia people among other patients are not like the normal patient. If it's for the money, it's a wrong approach. It has to, because you should have some compassion in your heart. You have to be the eyes, as I once mentioned before, the ears, the tongue, the brain, everything. You have to think in their world. There are times that you don't understand nothing that they're saying. It doesn't make sense asking them to repeat it, because doing that over and over may trigger them to get angry. And there's certain things that can even trigger dementia patients to get angry at any given time. So we have to be careful of the words we use, the tone of voice that we present before them. The eye gesture has to be great. Your facial expressions has to be refreshing. Your personality has to be pleasant. There are one kind of people that entice you to always do the right thing because they can lash out at any second. We don't want those kind of issues in the working place. We want to make sure these people are handled with love, integrity, and that the loved ones can say, well, you know what, my mom or my dad or my grandfather or grandmother, whoever they are getting the best treatment they possibly can. And as I said before earlier in the program, that activities are tailored to those either in groups who have similar experiences and want to have a socialized life with each other. That is also possible in the nursing home. There are groups of people who come together with similar experiences and social activities that you can group those people together and they get along well and they are comfortable where they are. There are some of those who want self-directed activities, but I always say that in self-directed activities, it's quite essential that sometimes they should have at least minimum supervision. The reason for that is that always remember again, their brain not always function, and they may think they're doing something right, and may very well be doing something wrong because the brain had crossed over into a different dimension and also will hurt themselves. So I believe that all activities, self-directed or group activities, whatever the case may be, should always have some form of supervision. In group activities, self-directed, need minimum supervision. Just give them the materials they need to work with, let them accomplish what they want to accomplish. But still, minimum supervision is always important. For those who are in groups and socializing, you can also watch the atmosphere. Those with sensory situations, always give them something that's comfortable in music. I don't think that because they are passive or be in a situation where they may be close to departing, that they can't hear. Sometimes, you know in what form, if it's music that they like, and that work well for them, give them some form of music that they can listen to. It stimulates their mind. You won't know it, but they know it. They may not be moving, they may be just staring at you, but they are enjoying themselves. And that is something good that you can do for any person in their last stages of life. With that said, this will bring us to the hour of part 2 of living in the dementia world, and in the near future we also will move on to part 3 of living in the dementia world. Until then, enjoy your day. And my name once again is Errol Forde.